Pond5.com.
It is a real pleasure in the name of the Animal Medical Center to host this, what we hope to be our first inaugural One Health Conference. It is a wonderful place to be in New York, to be able to partner with human hospitals and physicians from human hospitals to drive that concept from New York out to the rest of the country and the rest of the world.
There seems to be much more momentum for many different aspects of one medicine that should provide tremendous resources for our profession and for all patients that have cancer and other diseases. We can design strategies to try and reduce the risk or provide early detection. Currently, we're about 10 years behind the human field in understanding the genetic landscape of cancers and what drives those cancers. Canine osteosarcoma and human osteosarcoma are essentially indistinguishable. We've already had at least 3 to 5 litters born from these dogs that we've collected. So within a period of 10 to 15 years of this study, we will have many, many generations that could be followed.
The optic nerves sit right above the pituitary gland. Here's the pituitary gland. The carotid arteries are on either side. So you have to be very delicate with this surgery. In humans, it takes 2 of us. In dogs, it may only take 1. And so we went from a 10% leak to a point less than 1%. And this is a great result. Your lens, your light source, everything is big and bulky, and it sits outside the nose. But with an endoscope, we can advance the lens and the light source into the nose, and then we can look around.
This is the zeitgeist on what cancer is. All right, this is what you're seeing here is the politically correct way of talking about cancer.
Has anyone ever looked at leukocytes in other areas where they could be stressed, like in an abscess?
There's data and lots of thought that osteosarcoma.
We have to embed ourselves in each other's worlds, or else we're not going to hear stuff like this.
The Animal Medical Center is so close, and that we have, this population of patients that develop naturally occurring disease. And they develop naturally occurring disease in a very abbreviated fashion.
So we inject this DNA that's going to be taken up by the muscle cells. Then those muscle cells are going to be expressing that human tyrosinase protein. And then that human tyrosinase protein is going to be different enough from the dog tyrosinase to stimulate an immune response.
At the center of all of it seems to be RBMP53 alterations. And the challenge of that is RBMP53 are therapeutically challenging to target.
If the PD-L1 is there, those tumors are more responsive to PD-1 blockade, but not because the PD-L1 is there. The PD-L1 is there because there's an immune response.
This is Kiwi's tumor before radiation. And this is all that we can see now 3 months later.
Our conventional linear accelerators over recent years have been adapted to deliver highly focused radiation, stereotactic radiation. This is the Varian Edge machine, which we recently installed in our new facility.
Do we give low chemotherapy doses because the owners won't tolerate higher doses? And I think we don't have the answer to that question.
They have similar morphologies. 2 different kinds shown on the slide. On the top is a diffuse morphology where the whole lymph node is replaced.
You can see that the #1 cause of death in those dogs is cancer.
To get a real life sense of how drugs, how therapies are going to work in people, because it's a large animal. It's an animal we can apply surgical techniques to.
And if we don't impact that, then we'll never be able to cure these tumors. They'll go into remission, but the disease will recur.
To someone who doesn't deal with animal species became something of a different perspective for me, so I appreciate that.